Let me see, from Achola Rosario from Nairobi, who is asking, the most important component for health is changing the mindset of each household. Are there any plans for radio, TV, social media programs and infomercials? I don't know whether you're in a position to answer that question, but Berhan or anybody else who can respond to that.
Well, I can touch on the aspect of access to information being extremely important at this time, right? Like the one way that we can all protect ourselves, our loved ones, is by accessing really credible information. And what has been a challenge now is the troves of misinformation and disinformation, and of all of the cures apparently that whether presidents are suggesting or people are suggesting and passing on information about, like, really fake cures for COVID or all of those things. So the fact that governments should be providing, and other healthcare professionals should be providing accurate and accessible information. And one thing that's really important is it can't just be on WhatsApp, because a lot of people that majority of the population that is not connected to the internet doesn't have WhatsApp, or doesn't necessarily have the money to pay for WhatsApp specifically as well. So using radio, and I think Megan was also talking about radio being used in the Nigerian context. I think that's really important, making sure that we get to the people with whatever platforms that are most available to them. There shouldn't be a barrier to access to information. So that's one thing that I would say on that.
Sheila, maybe I can also say something about information. I think this is a time of crisis when people have come together for the common good of the society. And it has already been identified that the next biggest challenge that we have close to this COVID is gender-based violence, which is cutting across children, people with disability, the elderly, and everybody is suffering some form of violence one way or the other. The question Achola asked whether there could be programs through the radio or TV to educate people to change their mindset about, being, respectful to one another, avoiding violence. I think this is a message that should go clear to the policymakers, about messages that say violence within the domestic violence within homes, intolerance of one another is unacceptable. I think if this message can find its way now to be mainstreamed within the COVID disaster management strategies that have been put in place, it can work, and we should explore that.
Thank you, Judge. She has given us an area that we can actually move forward and explore further, but there's a question related to that from Linda Bonio, and she's asking, is it possible to have quick policy responses rather than hope that technologies will fill this infodemic? So I think that question can go to, I think that question can still go to Berhan and maybe the judge, or Megan, I don't know. Oh, Changu, you want to answer that? Please go ahead.
Yeah. I wanted to link my response in terms of quick policy responses, also to the response on changing mindsets, because that is what education should be about. And this changing mindset is not just linked to health, it's also linked to social norms and gender stereotypes which endanger the mutual respect. So what I really would say is that in education and in the mass media, also through campaigns, we should really push the type of courses which we already have but can be sharpened, which are focusing on emotional intelligence, on changing minds, and on human rights, and also programs and training which encourage girls and boys, men and women to interact and live together as friends with mutual respect. And also for men and boys to see gender-based violence as also their problem, not the problem of women, and for women and girls to also communicate. So I think at a policy level, mass campaigns using radio and all other mass media should also be linked to what is happening in the education sector and what is happening in raising money, private-public partnership funds to make all these things to happen. So it should be really kind of simultaneous action with all stakeholders involved.
Thank you, Changu. I'll just ask the question, and whoever wants to jump in can jump in and respond to those questions. There's a question from Charles Cado, who is from the education fraternity, and he's asking, how could the cultural beliefs and myths that evolve around the pandemics but considered gender-based violence be handled? Any successes to benchmark with? So anybody wants to jump in? Megan?
I'm happy to start here and then, turn to others. I mean, I think this question is somewhat linked to the one that Berhan just addressed about changing sort of social norms within the household and communities through these platforms. And I feel like in addition to, not being able to agree more with what she said about conveying accurate, scientific, evidence-based information, there's opportunities for sort of role model effects in a sense, especially to younger populations, adolescents who are still learning how to engage with the opposite sex, with their peers, with their families in healthy, kind of productive and safe ways. So the two studies that stick out in my mind, one comes from Eliana La Ferreira and a group of researchers that looked at telenovelas, just soap operas in Brazil. And a pretty cool study that I think we could build on and model elsewhere, that showed that women's preferences for what they wanted to do in terms of getting pregnant, how many children they wanted to have, what kind of sexual relationships they wanted to have, and how healthy and equal those were changed because there were these role models just delivered to them through the TV for how women were more empowered within their households and their romantic relationships. Another example that's more practical, to my knowledge, it hasn't been rigorously evaluated yet, but gets a lot of attention, and rightfully so, is on the continent, MTV Shuga, which again sort of targets teen populations and talks about healthy relationships, healthy sex, education, and advancement sort of within the workforce. So these are models that I think we can be looking to in COVID and much more broadly, obviously.
Thank you for that, Megan. Anybody else want to respond to this question? Or we can, I think the other questions that are related, so let's ask the other questions and then you can come in. So we have a question from Juliet Root. Juliet is asking, my concern is on children in abusive situations within the family. Which community networks protect the children or report the cases on their behalf, especially during crisis? So this is, I think, Juliet Nyambura who's asking this question. Anybody want to go?
Wow. I think this is a difficult question, which was alluded to earlier in the presentation, I think, by Megan, that during this difficult time, families are isolated because of, social distancing. So the lockdown means that a lot of abuse can go unreported. There has been a lot of work meant to empower children to become agents of themselves so that they can be able to report cases of violence against themselves. But in this situation now, who do they report to? They are probably victims of violence by the caregivers who are supposed to be taking care of them. They have no access to telephones so that they can probably call, an auntie or a relative or a social worker, or even the 911 number. So this is a real practical problem, Juliet, that is at the moment that children are probably, many children are locked in very abusive situations. Even when they are rescued, the problem is compounded further. As I said, many of the government institutions are also on lockdown. They are not accepting people who are coming from outside because they want to protect those who are inside from any kind of contamination coming from outside. And we were actually told when the children who have been rescued are taken to those institutions, they are being turned away. And they are depending on the mercy of child charitable institutions to take them. And also very few charitable institutions are willing to take these kinds of children. And that is why we recommended that there should be some kind of quarantine house, one of the institutions be prepared for this kind of cases so that they can be rescued and put there. But even the rescue effort itself is challenged at this minute. I guess more education so that children can learn how to report these cases for themselves. Because I don't think social workers are around to go to homes and make visits because of the lockdown.
A related question that is asked by Sam Mukudi from Nyeri, Kenya, and he's asking, what considerations are given to children when pushing parents to quarantine and to jail over COVID-19? What happens to them?
These now become children in need of care and protection. If a parent has been pushed to the quarantine, the people pushing that parent to the quarantine should immediately report to the children officer, a social worker, that there are children in need of care and protection, so that those children can be put under the care of a guardian, or the government can take responsibility of taking care of those children, taking them maybe to an institution. And this is why there has been a huge outcry about the indiscriminate arrest of routing people who are contravening the regulations and taking them to quarantine centers without caring whether they are nursing mothers who have babies, whether they have children. I think that debate is arrived in Kenya, but in all cases involving children, their best interest should be taken care of, and mechanisms should be put in place if somebody has young children. One of the things they should consider is this person should be quarantined within a place where the children will not be stressed, where they can be assured that the person is going to be okay, and they are also going to be okay. So I think there are social workers working with the COVID-19 emergency teams for the support of the children. But this is a very, very important question based about children.
sorry. I was saying there's a question from Sam of the African Institute of Children's Studies, and he's asking, are there models of what works in responding to gender-based violence at community level, considering that social workers are in many countries not frontline workers? Is there anybody who can answer that question?
Yes, and I'm sure my other colleagues can also provide examples. I think this gives me an opportunity to talk about schools as safety zones and also centers of learning. So we have examples in places like Swaziland, Mozambique, Kenya, where you find that NGOs with UN agencies and government, they don't just make the school a place for learning, but they make sure that there is water and sanitation, that there is school feeding, and that issues of psychosocial support by bringing social workers are addressed in school. And those children from child-headed households or who are orphans, who are in school, social welfare should be aware of them. And then there's also like Childline in places like Botswana, South Africa, or Swaziland, where the young people, especially girls, can pick up a phone and report abuse. So those type of initiatives have been shown to work. The challenge is how to scale them so that they are in more communities. You'll find that they're only maybe in a city or in a small village, but how do you scale them so that more of these young people can benefit from those type of initiatives?
Changu, let's move on to the next question. And there's a question from Botswana, though anybody can answer it. And this is Godisang Mukodi, who's asking, the University of Botswana has a sexual harassment policy which is not being implemented. How can alliances between staff and student gender activists make a difference? And you can answer it, but anybody else is also free to answer that. Maybe Megan.
Yeah.
Something.
Sure, I can start and then try to turn to others. I mean, I feel like sexual harassment policies have come to the fore where I sit in the US and also more broadly and more globally through the Me Too movement. So lots of conversations around social activism and community organizing by having this issue finally, within the workplace, especially including universities and for students where that is their work, shed light on sexual harassment in those contexts. So I think one of the things is to ensure we keep broader momentum apace while all eyes are on this global health crisis. I think there is a huge risk that issues like climate change, issues like gender equality and sexual harassment that we're starting to gain some traction are now going to be detracted from or take a step back because all eyes are on the health space. So I think it will be a very interesting question for all of us who work on these issues day to day, to ensure that we're not only considering the gender dimensions and the gender-based violence specific dimensions of COVID, but how do we keep up the progress more broadly? I don't have any particularly innovative insights on that front, but I think worth emphasizing that this is an issue that, as Judge Koome was emphasizing, that predated and needs to continue to be emphasized even more so going forward.
So we have a question from Dr. Jaya Nair from Perth, Australia, Stroke India, and she's asking, what is the significance of women community groups who can support each other, and through those groups, education, technical and legal support can be provided to women and children in crisis?
Women community groups actually in Eastern and Southern Africa, they are really doing fantastic work when it comes to gender-based violence. And but they do need a lot of support, because those of us who work with NGOs, we are very much aware that the funding and support for NGOs has really been going down over the last 10 years. For instance, here in Botswana, in South Africa, women NGOs have established that since the lockdown for the last 3 weeks to a month, the cases of gender-based violence have doubled. In some instances, more than doubled in some of the countries. And so there has been a demand, even from governments, for these organizations to support. Like here in Botswana, we've got this organization which made a huge outcry for support through the social media, through the radio, and got a safe house. They got a safe house for those women and children who needed a safe house. But then the issue is, when there is a lockdown, how do you provide food, utensils, and all that? So there has been that type of call, but there's also a challenge. How do you get those things? And then government also has to work with this type of women's groups. And some of these women's groups do fantastic research, but it's short term. We need to find ways of providing funds for them to work with university to have much more long-term research, which can really help us to trace the impact and also to address the type of appropriate interventions.
Thank you, Changu. To quickly move on to question, going back to technology and data. This is from Conrad, who is asking, in the light of the current situation of COVID-19, how has technology been used so far in obtaining relevant information to act on?
I can take that. So that's definitely a very broad question, but I would, I guess I'll more or less focus it on contact tracing apps and some of the tools that governments and civil society organizations have been using. So we've seen whether here in Kenya, trying to not necessarily do contact tracing, but rather for public service vehicles, asking them to install apps that would technically monitor who comes onto public vehicles. Or in South Korea and other places, we've seen governments use contact tracing apps to actually monitor who has been in contact and to isolate people. The other ways that we've seen here as well in Kenya and other places is how governments have been using mobile surveillance to actually see if those in quarantine are breaking out of quarantine, or are those that have been told to self-isolate have been self-isolating. So in some ways it has been useful, but some of the things that we as a digital rights organization have seen is the misuse of that information, the lack of consent, the lack of data privacy and protections that are supposed to be put in place, and the sharing. We've seen also the surveillance companies like the NSO group in Israel, for instance, being asked to come in and assist with these things, while these companies have been implicated in many human rights violations. We've also have seen companies, telecom companies, for instance, readily sharing data with government. So some of the things that we're worried about here at this juncture is really rolling back some of the privacy issues and the privacy violations that are happening currently within many countries, whether you look at South Africa or other places. So yes, technology has been used and it's good, and we should put privacy measures in place and go ahead with using some of these things that governments are using, but that protection should definitely be put in place. Data protection commissioners should be engaged, and the third party or public-private partnership should be really stringent so that they don't violate people's right. And it's also, health data is also extremely sensitive, and really so how that information is being shared is also really critical. So we've had that engagement of technology is really good, but we haven't really asked the right questions as civil society or as governments to these companies. We're now have seen, Apple and Google are going to be launching their own apps that are going to help governments monitor individuals. So what does that mean when we're talking about, fundamental human rights, privacy of individuals? So these are some of the questions that we're asking. And as always, this always affects folks that are, marginalized, vulnerable, like women, when compared to other part of the population.
Thank you. Berhan, we have a question from Dr. Alice Umariba, who is asking, what are the salient features learned from this, and what can be done in future to reduce risks for girls in times of crisis? Maybe we can give one or two features, given that we're running short of time. So whoever wants to take this on, Berhan or anybody else? Okay.
Go ahead, Justice, you start.
Oh, okay. No, it's you. I want to hear from you first.
Okay, thank you. Very quickly, there's one program that comes to mind that we saw a lot of promising results from. It's the Empowerment and Livelihoods for Adolescents program out of Sierra Leone that happened to be implemented and then rigorously evaluated during the Ebola outbreak. And it showed, consistent with some of the research that Changu and others have referenced, that these safe spaces for girls especially make a huge difference. So it is this multifaceted sort of holistic approach, making sure that girls have one another and peer and sort of mentor advisors as support networks. They're able to spend their time in productive ways, gaining skills, undertaking productive activities that will eventually lead to livelihoods, income generation. So there is this sort of useful way of spending time as opposed to being in the context I referenced where transactional coerced sex, more time spent with older men is present. So that's one program to turn to as an example.
I think I was going to speak about almost the same, that when we are dealing with a crisis, it is important to mainstream programs that are targeting like child protection within the crisis, gender-based violence as a category, so that as we deal with the crisis, there is an aspect of the programs or systems that have been put in place that addresses the unique problems of gender-based violence, especially looking at children, women, persons with disability, so that their problems are also taken into account. That's what I would say, that this time we just dealing with the crisis, COVID, and nothing more. So we need now to learn that there are these categories, groups, vulnerable groups that need special attention and special programs targeted to their protection.
Thank you, Judge. We'll just take one or two more questions because before we conclude. And so we have Dr. Purity Thiga who's asking, how does one address the challenge of denial of access to the target population in educational institutions to collect research data on GBV because of denial and stigma?
Thank you for that. Yes, thank you for that important question. So denial of access, it also depends on where the access has been denied. My assumption is that it's been denied maybe at the community level, but when somebody is going to collect the actual data. But it's not really a question of denial, but it's because issues which are so private and sensitive as sexual-based violence, you find that the survivor is definitely does not want to make it public. And that is why the methods of collecting data have to really be gender responsive, and they have to be ethical, so that the person who is a survivor can be sure that that confidentiality will be kept, because what you are looking for when you're researching is data. You are not looking to actually showcase an individual. You are looking for data so that you make use of that data to generalize in terms of what type of interventions are more appropriate, or what interventions are working. So I think it is the responsibility of the researcher to ensure that the person who is a survivor and is being researched on has the trust and confidence in the researcher. And then that is why in some situations, when you are conducting research, it's secretive with that one individual. In other situations, you have a peer group of girls, and then they speak freely, and then one of them or two of them who is abused will come up with the reality as it is, without identifying an individual. So there are a variety of ways of ensuring that you get the data without exposing a vulnerable survivor of violence.
So the very final question that we'll ask now, but remember, we will continue with this discussion. The questions that you've given us, we will be responding to them, but maybe not right now. So the final one that I'm taking in order of the order that we've received is from Karanja, and this is I think more like a policy recommendation. Can we implement a public register of all sexual offenders, especially those who target children, as a preventative social protection measure? I think that's a legal question.
Yes, I think I can answer that, Sheila, and say that in Kenya, we have the Sexual Offences Act, and there's a provision that we maintain a sexual offenders register. Everybody who has been convicted of a sexual offense act is in that register. The problem is that it is kept by the registrar of the judiciary. I don't think it's a public document where you can go to our website and access it. Some work is being done around it to improve on the data within that public register, to make sure that all cases, because we are not even sure that all the offenders have been captured in that register. So there's a cleanup exercise going on, and some rules and regulations on how it can be accessed. They have not yet been finalized. There's a committee working on it. But there is a register like that. And I believe in many countries, they have a register of dangerous sexual offenders who should be captured and known wherever they go.
Thank you, Judge. There's so many other questions coming in, but we really must end the session now. But the questions that we have not asked right now, I think the conversation we will continue with this conversation offline. And for those whose questions we have not been able to take on today, we are going to share with the panelists, and we shall compile them and put all the questions and answers up on our Jaslika blog. So I think with that, I would really like to thank everybody, the panelists, for honoring our invitation and having the patience to be here for so long. We have gone over the time that we had expected, but you have been here very patiently. And the same thing with the audience. I think we've had a tremendous audience we've exceeded our expectations.